one of the things I think, following on again from Amitabh Bachchan, is that in a third wave, say it happens, whatever, November, December, January, God knows when, and God forbid it happens at all, but we want our children to go back to school. But we keep talking about vaccines only for 18 plus. Shouldn't we think about our children? I mean, they are our goalkeepers, they are our future. It's like going into a cricket match without a wicketkeeper, without a football match without a goalkeeper, if we don't look after our children. So shouldn't we really look forward and start considering vaccination of people under 18 as well?
So I totally agree with you. I think physical schools is very, very important for children and for college-going students also. And there's been a lot of this which has been sort of not been there. And when we talk of schools and colleges, it's not only about education, it's about character building. It's about getting people to have socialized, to really become good individuals, good citizens of the country. And therefore, physical schools are important. Also, it really marginalizes those who don't have access to the internet or not tech savvy. And therefore, that marginalized population has not had any education for the last 1.5 years. Therefore, opening schools is very important. But the other important thing is to do it in a manner that we don't allow the infection to spread and are able to protect children. I think to do that, vaccination is the strategy. Along with that, we will have to develop other measures. The Pfizer vaccine already has been approved for children. The Zydus vaccine, the Zydus Cadilla vaccine, which is made in India, which is a DNA vaccine, also has been tried in children, as has been shown to be safe. And the Bharat Biotech vaccine is also undergoing trials, and hopefully by September, the approval for that should also come. The other important thing that I'd like to mention is, because this issue has always come up, that the third wave is going to affect a lot of children. I don't think that is true for 2 or 3 reasons. The previous waves and the ongoing pandemic has not caused a severe infection as far as children are concerned. Secondly, data that we looked at, a SERO surveillance that we did as a sentinel surveillance, showed that a large number of children, more than 50% of children who were tested both in urban and rural area, already had antibodies. So they had got the infection, which was mild, and they had already been protected. Research will evolve, and we will have new research coming up. But the important thing is to remember that the virus is also evolving. So we have to be careful when we look at both how the virus evolves and what the research comes up, and whether that research is up to date with the way the virus is behaving today. Because what research we have may be a few months old, but that may not be relevant today, as we've seen with the older variant and the Delta variant. The Delta variant was much more infectious and caused this huge spike that we saw in the second wave, unlike the first wave, which was with the original Wuhan strain. So there is a sort of a time lag which we have to be cognizant of,
that is
and
a
therefore
big
vaccine is something that we need to push aggressively in children.